All right, so the time is 12:02, and we're going to get going with this edition of our Samaritan Advantage Health Plan Lunch and Learn. I hope you are all doing well out there in virtual land, and we're really, really excited that you could join us for today's offering. Our main presenter today is Daniele Hunter, and she is the Implementation Program Manager for Samaritan Health Plan's Medicare programs. Danielle has worked for Samaritan for 8 years, and before coming to Samaritan, she worked as a pharmacy technician while obtaining her bachelor's degree in general science at Oregon State University. Go Beavs. But for all those Duck fans out there, my daughter's a Duck right now in her senior year, so I got both sides covered. But Danielle has worked in a number of different departments within Samaritan over the last several years, including pharmacy services, in appeals and grievances. And I've worked closely with Danielle in those areas, and I know Danielle does an amazing job. For the last 3 years, though, she's been supporting the Medicare plans and joined Medicare Programs Department when it was formed in calendar year 2020. So during the question and answer portion of the presentation today, we're going to be joined by representatives from a number of Samaritan Health Plans departments who can best answer those questions, and I will introduce those representatives later. But the next slide, we wanted to just talk about today's presentation a little bit and do some quick rules of engagement, the rules of the road. So please use the meeting chat feature to type your questions or make comments or raise your hands, and I will watch that as best as I can. Because there's some benefit questions that might have some complexity to it as well. There could be questions that just can't be answered today. But if that happens, we are going to include those questions and answers in a follow-up email that you'll receive with survey questions as well, along with the video presentation. We'll also mail the questions and answers with the gift card in case you don't have internet access or miss the email. So most importantly, during this time of technology and virtual meetings, please bear with us if we do have any technical issues that are being experienced, and we'll try to work through these as best we can. You can expect a survey to be mailed out to you within about 2 weeks, and that's along with a recording of this presentation. We would appreciate your feedback regarding today's presentation. And as a result of the survey feedback from our November Lunch and Learn, we'll be substituting a $15 Safeway gift card instead of the $15 Subway gift card. So you can use that for your lunch at the deli counter, use it for some groceries, use it for gas. We know that the gas prices are really going up, or use it for some necessary prescriptions. And thank you again for your feedback. Keep it coming our way because this is how we plan these future events for you. And without further ado, I'm going to hand it over next to my colleague, Danielle.
So I am so grateful to have this opportunity to talk with you all a little bit about your Samaritan Advantage benefits for 2022. We've really tried to take the opportunity to listen to our members, to continue offering you exciting new benefits, along with lower premiums, lower copays. I don't have the time, unfortunately, to talk about every single benefit that we offer under our plan. So I wanted to take this opportunity to focus on the benefits that we've changed or added in 2022, and then we'll sprinkle a few other ones in there as well. So to start with, our premium changes for 2022, for those of you on our Premier Plan Plus, that premium amount did remain the same at $129. For our Premier Plan members, the premium lowered from $35 to $19 this year. A little fun fact that I found, this is actually the 5th year in a row that we've lowered the premium amount for that plan. For our conventional plan, we lowered the premium from $70 to $50. And that's our plan that does not offer the Part D prescription drug benefit. For members on our special needs plan, which is for members who are dually eligible for Medicare and Medicaid benefits, that premium actually increased from $36 to $40.50. For those that don't know, that premium amount is actually determined by the Centers for Medicare and Medicaid Services, or CMS. You'll hear me refer to them a few times throughout the presentation. They're kind of the governing body that tells us what we can and can't do as a Medicare Advantage plan. And also wanted to point out that the members who are on that plan do receive extra help, so they won't actually pay that amount out of their pocket. And then at this point, I'm going to have Mary help me by doing our first poll question for the group. So for those of you that have joined us through the Teams app or through the web-based platform for Teams, you should see the question pop up on your screen or in the chat box on the right side of your screen. And it will show you the question, the options for response, and you'll just select your answer and click, I think it's submit or send. Unfortunately, for those of you who have joined us through the phone today, there is not a way for you to participate in the poll question. Mary, do you want to go ahead and do our first question?
I submitted that. Are you seeing it?
Yeah, it came through, Mary.
Oh, good.
Okay, so curious to know, which plan are you on? What members do we have here from our Samaritan Advantage plans? You're on our Premier Plan Plus, our Premier Plan, our Conventional Plan, or our SNP plan. Or maybe you're not sure.
And are you seeing the details now of the results? Oops, I was going to.
There we go. Okay, so it looks like got a few responses in here. Majority of the members are on our Premier Plan. Got a few Premier Plan Plus members.
And Mary and Danielle, some of people are putting responses in the chat as well with their numbers or the type of plan they're in.
Okay, great. Oh yeah, there's some Premier Plan Plus, special needs. All right. Okay, so kicking it off with some of the benefits that we lowered copays for. First is our primary care visits. And so this change really came out of feedback from our providers, actually. We asked them when we were doing benefit changes, from their perspective, what do you see as barriers to care? And one of the major ones was, copays for those visits. So we had the opportunity to lower that primary care visit copay on many of our plans. So for our Premier Plan Plus, it was lowered from $5 to $0. On our Premier Plan, $10 to $5, and our conventional plan stayed the same at $10. And for those of you that may not know, we also offer free telehealth visits with your primary care physician. So if for some reason you aren't able to go into their office, many of the providers are able to offer a telehealth visit for you instead, where you can talk to them from the comfort of your home. And preventive care services are always free. All of our plans, those are no cost to you. Really important to make sure that you have your annual wellness visit, any other screenings, things like that for your health. So this is just a short list of some of the preventive care services that are offered. If you want to see the full list of preventive care services, you can refer to the benefits chart that's in Chapter 4 of your evidence of coverage. All of our preventive services have a little apple icon in the top left corner of that benefit. And some additional care resources that we offer for our plan. So free virtual care and a free nurse advice line. That's available 24 hours a day, 7 days a week. The virtual care platform is offered through Samaritan, so it's our telehealth platform for members if maybe you're not able to get into your PCP, you have a condition, you're not comfortable going to urgent care, some of that, but you need to talk to a provider, you can use our virtual care platform for free. And they are able to diagnose, treat, prescribe for non-emergency conditions. Some of the examples are here: allergy symptoms, cold and flu, respiratory sinus problems, that stuff. Really simple to use. I've used it myself. My husband's used it a couple of times, especially in this pandemic era. That's a really great benefit to take advantage of. And then our nurse advice line. So if you have questions, maybe you don't know if you need to see a doctor, or your questions maybe don't require a provider or physician. You want to know, where should I go for care? I have questions about my diagnosis or treatment options. Then you can call through this free nurse advice line, which again is available 24 hours a day, 7 days a week. And continuing with our lower copays, this was a really exciting one for us this year, our outpatient mental health and psychiatric services benefit. So this benefit includes coverage for individual and group therapy sessions. Your mental health is just as important as your physical health. And we don't want our members to feel a financial burden because you need to have a visit with a mental health provider. So we lowered those copays so they actually match the same amount that you would pay for a visit with your primary care physician. So for Premier Plan Plus, that meant lowering the copay from $30 to $0. For the Premier Plan, again, lowering from $30 down to $5. And our conventional plan lowering from $20 to $10. And at this point, while we are in a pandemic, there are many providers that are offering virtual telehealth visits under this benefit as well. And a pharmacy change. So a 90-day supply for drugs that are on Tier 1, Tier 2, and Tier 3. We lowered that cost sharing, so you pay 2 months worth of copays to get 3 months worth of medication. So there's a lot of benefits to that. The first being that saves you money on your prescriptions. You have fewer trips to the pharmacy, and you'll be less likely to run out of your medication and end up missing a dose. So for Tier 1 medications, that means for 90-day supply, it went down from $9 to $6. Tier 2 went down from $27 to $18. And Tier 3 went down from $141 to $94. And I did want to point out that these are the amounts that you pay while you're in the initial coverage phase. And those copays might change if you're in a different coverage phase, such as the coverage gap or the catastrophic coverage phase, depending on what plan you're on with us. And since I brought it up, we're going to talk just a little bit about the Part D coverage gap. A lot of people's favorite subject. So what is the Part D coverage gap? This is most commonly referred to as the donut hole. And you'll enter that coverage gap when your total drug spend equals a certain amount. And your drug spend is what you pay as the member, so copays or coinsurance, plus what we as the plan pay to the pharmacy after you've paid your copay or coinsurance. This amount is determined every year by CMS. And in 2022, the amount to enter the coverage gap or donut hole is $4,430. And when you're in the coverage gap, so CMS actually also applies a discount to all generic and brand drugs to help limit the amount that you end up paying out of your pocket while you're in the gap. So for Premier members, that means that you'll pay 25% coinsurance for generic and brand drugs. For our Premier Plan Plus members, we actually offer additional coverage while you're in the gap. And so that protects the copay amounts for your Tier 1 and Tier 2 medications, and as well as the Tier 6 copay. So you'll pay depending on what tier your drug falls in, you'll pay either the tier 1, tier 2 copay or 25% coinsurance, whichever amount is lower. And then for drugs on tier 6, you will still have no copay for those drugs. To leave the gap, your year-to-date drug costs, so that amount that you have paid in copays and coinsurance, has to total up to a certain amount, which again is set by CMS every year. And this year that amount is $7,050, excuse me. As a helpful tip, you can review your monthly pharmacy EOBs that we send you to stay up to date on which coverage stage that you're in and how close you are to entering the next stage of coverage. And if you ever have any questions, you can call our customer service team or pharmacy services team, and they can help you answer any questions. Another really great program that's offered through your Part D drug benefit is our Medication Therapy Management Program, or MTM program. It's specifically designed to help you get the most out of your medications and your Samaritan drug benefit. So it helps you reduce your risk for drug interactions or side effects, help you potentially find a lower cost medication, and just an opportunity to answer questions that you have about medications. And it's completely free for members who choose to participate. So we've partnered with a really great vendor called MyMTM to help us administer the program. They're a pharmacist-owned and operated company out of Oregon. And every quarter, based on criteria, we'll automatically enroll members. And if you were enrolled, then MyMTM will contact you and offer you a free comprehensive medication review. And so during that review, you'll have the opportunity to talk to a pharmacist. They'll discuss all of your prescription medications as well as any over-the-counter medications that you might be taking. And after the review, they'll send you a copy of everything that was discussed and mail it to you. And you can take that documentation to your next provider visit and discuss that with them. And just to make sure that everybody's still listening to me, we've got another poll question for you. And I'll cue that up, Mary. Okay. So which of these options do you feel best describes your knowledge of your benefits? You benefit master, you just know enough to be a little dangerous, maybe you're only familiar with the benefits that you use, or you're just not sure. Have to be dangerous. Okay, so it looks like the majority of you are pretty familiar with what you use. Got a few people that aren't sure what their benefits are, although hopefully we answered at least a few questions there, a little bit now. Really great responses. Okay, go back to my presentation. So now I'll talk a little bit about the new benefits that we've added. The first of which is dental. So we added dental to our Premier Plan and our conventional plan in 2022. The Premier Plan Plus had a dental benefit previously, but for those of you that were maybe on the plan before, we've changed the way that benefit is offered. So now all three of these plans offer an annual benefit dollar amount that you can use towards whatever services that you need. So, we really wanted you as the members to be able to have that money and use it in the way that works best for you. So our dental benefit, what's covered, what's not covered. Really the only thing that's not covered is orthodontia. Everything else, and this is again not all inclusive, but some good examples of the more common ones. So your cleanings, your exams, your x-rays, fillings, crowns, dentures, periodontal services, you want whitening services, implants. I mean, there's all kinds of things that this benefit can cover for you. Our special needs plan does not offer an additional dental benefit at this time, but those members do have dental benefits through the Medicaid coverage. And if you have any questions about that, please contact our customer service department. Next new benefit, hearing aids. So we added hearing aid coverage to all of our plans in 2022. For Premier Plan Plus, we increased that amount to $1,000 from $500 that we offered in 2021. Premier Plan and Conventional Plan have $500 per calendar year, and the Special Needs Plan has $750 per calendar year, which is also an increase from $500 in 2021. So you can use this benefit amount to pay for hearing aids themselves, any hearing aid supplies, and also the cost for hearing aid repairs. The one thing that is not covered under this benefit are hearing aid batteries, unless they're factory packaged when you purchase your hearing aid. And that's not because we don't want to. Unfortunately, CMS, Centers for Medicare and Medicaid, will not allow us to pay for hearing aid batteries. And next, our transportation benefit. This was really exciting for us to add this year as well. So on all of our plans, you have a transportation benefit that can take you to any health-related location. For our Premier Plan Plus, Premier, and Conventional members, you have 12 one-way trips or 6 round trips per year. And our Special Needs Plan members have 24 one-way trips or 12 round trips per year. And so we've contracted with Rideline to help us administer the transportation benefit. They're actually the same company that administers transportation benefit for members who are on Medicaid or the Oregon Health Plan. You can call Rideline Monday through Friday. They're open 8 to 5. They are closed on most holidays, but they can give you rides 24 hours a day, 365 days a year. There are no distance limitations. So if you're on the coast and you need to go to Portland or Eugene or somewhere like that, we can take you there. Our types of transportation that are available, there's sedans for our members who are ambulatory and vans for members who are wheelchair bound. And some examples of health-related locations that you can use this benefit for. There's the obvious ones, your provider's office, hospitals, urgent care, emergency room. But you can also use it if you need a ride to the gym. If there's a vaccination clinic you want to attend, we can take you there. Is there a senior center event maybe that you want to attend? You can use this transportation benefit to take you there. And a few examples of locations that are not covered. We can't take you to the airport, unfortunately, or to a friend or family's home. No convenience stores and no dispensaries. And lastly is our new quarterly allowance for over-the-counter items. So this is one that we are offering across all of our plans this year. For Premier Plan Plus, Premier, and Conventional members, you have $100 per quarter. And our Special Needs Plan members have $150 per quarter. So that amount does not roll over to the next quarter. You use it or lose it. CMS is really who dictates what is and isn't coverable under the over-the-counter benefit. So they've categorized items 3 ways. You have eligible items that are considered dual purpose. So those are things that have what they call a health-related use or potentially non-health related use. And then there are the ineligible items. So some examples of eligible items are things like allergy medicine, cough and cold, first aid supplies, incontinence supplies, your first aid, nicotine gum and patches, sleep aids, things like that. Examples of dual purpose items, hormone supplements, scales, and then all the vitamins and minerals fall under that as well. Items that are not eligible under this benefit, alternative medicines, arch supports, botanical and herbal supplements. So that's things like cranberry, St. John's wort, echinacea, those things that come from an herbal botanical derivative. Contraceptives, food, hearing aid batteries, again, unfortunately, also not able to be covered under this benefit. Magnifying glasses and mouthwash, so convenience items or cosmetics too, so shampoos, makeup, those things are not eligible to purchase under this benefit. Our new benefits card, so probably what a lot of you are here to learn about. Our new benefits card is a MasterCard that is preloaded with the funds to pay for that OTC benefit that we just talked about, your hearing aids, hearing aid supplies and repairs, any routine vision hardware, so glasses and contact lenses, and then your dental services. So basically, any of those supplemental benefits that have a dollar allowance that we give you per year are loaded onto this card to give you easier access to use those funds. This is not the same as a flexible spending account that maybe you had if you were on a different commercial plan before going to Medicare. So it can't be used for the cost of copays, but it also doesn't require you to submit any additional information once a transaction is successful. So those of you that are familiar with a flexible spending account, once you use your card to pay for a doctor's visit or certain over-the-counter items, you actually have to submit additional documentation to support that purchase. And this card doesn't require that. And you have the ability to check your account balances by logging into our My Health Plan member portal. And there's a link on the right-hand side of the page that says My Benefits Card Login. And that'll take you there to see your account balances for each benefit. Or you can also use the IVR number that's on the back of the card, and that will tell you your current account balances for each benefit. Okay, so how does this work? For OTC benefit, the quarterly amount that we allow for each plan is automatically loaded on the first day of each quarter. And you can use the benefits card to pay for the eligible OTC items at most retailers or pharmacies that accept MasterCard. And so the technology behind the card makes it so that when you swipe it at the register, any items that are covered will pay, and then it will show you a decline for any items that aren't covered. So you can make that choice there at the register. Do I want to pay out of pocket for that item, or do I want to put it back? And the card works using what's called an Inventory Information Approval System, or IIAS. So most stores will have a system like this in place. And the card uses that technology to compare the item that you're purchasing with a master list of items that's maintained by the Special Interest Group for IIAS standards, or CJIS. And so that master list, again, is based off of CMS's requirements of what we kind of went over earlier, what's eligible, what's not eligible. And for a transaction to be successful, it requires that that item being purchased is on that CJIS list, or potentially that a merchant has gone into their system and updated it to reflect that that particular item is coverable. So it does require that the merchant where you're at has their system up to date to reflect eligibility of items. And that CJIS list is a nationally maintained list, so it's going to mostly have the big name, brand named items that are regularly stocked in stores. So, you know, the brand name Tylenol, your brand name allergy medications, those things. It's less likely to have some of the generic items on there, which, you know, we've already had feedback from members that trying to purchase a store brand of certain items is not successful at the register. And so that's a little bit of the reason behind why you might experience that. And then for the dual purpose items I mentioned, so the things like vitamins and supplements, and some of those support items. So CMS requires that you've had a conversation with your provider prior to purchasing an item that's considered dual eligible. And so that's part of the reason why those items won't work at point of sale using the card, because it works right there at the register. There's no way for that technology and functionality to know if you've had that conversation. So if you pay out of pocket for an item that's considered dual purchase, like a vitamin or a mineral, you can submit for reimbursement for that, and we will reimburse that amount for you. And then for dental services, hearing aids, and routine vision, again, that annual amount is automatically loaded to the card on your first date of eligibility. And then, you know, as you use those services, it will deduct the amount from that annual amount that you were allowed. And once you've depleted that amount, then the card will decline and will no longer work until the next benefit year when it gets reloaded again. And for those benefits, the card is controlled by what's called a merchant category code. And so that's basically a number that's assigned to the merchant's payment system, and it indicates what kinds of goods or services that they provide. And that's what prevents the card from, you know, basically being able to be used anywhere, and how it knows which bucket of money that it should deduct that amount from. So the covered locations are dentists and orthodontists, hearing aid providers, opticians, and optical goods and eyeglasses, and then optometrists and ophthalmologists. So a good tip, if you are in like an actual provider's office, for example, maybe you see an ear, nose, and throat specialist, and they also happen to sell hearing aids. The card will most likely not work in that location because their merchant category code will be assigned as a physician or doctor's office rather than a hearing aid merchant. So if you experience an instance like that, please contact our customer service team, and there are some ways that we can help you with that. So to summarize with the benefits cards, what should you use the benefit card to pay for? So your routine vision hardware, lenses, frames, and contacts, your hearing aids, hearing aid supplies and repairs, your preventive and comprehensive dental services, we talked about, so cleanings, exams, x-rays, all that good stuff, and then your eligible OTC items. What you do not want to use this card to pay for are any of your exams that go along. So none of your vision exams, none of your hearing exams, those are all paid directly through the plan and have a copay amount associated with them. So you'll want to make sure that you communicate that with your vision provider when you're paying for services. You know, only my eyeglasses go on this card. They can run it for that specific amount, but please bill my plan for my exams. And then Medicare covered dental services. So this is a really specific coverage for dental care. It's you know, limited to surgery of the jaw related structure, setting of fractures of the jaw or facial bones, or extraction of the teeth. Sometimes that's called medical dental, and your dentist should know that that's separate. They bill that to your medical plan. It's not covered under your dental benefit. Okay, so that is all that I had for my presentation. So I'll hand it back to Dr. E. I will go ahead and do questions and open discussion. I do have a few questions that were submitted by members beforehand, so I want to make sure that I address those before we open it up to everybody asking questions.
Great. Thank you so much for that, Danielle. And I myself learned new things about our benefits that I wasn't aware of. So I hope that that was informative for you as well. There were many questions in the chat about how do I get this card. So I'm first going to introduce members of our Samaritan Health Plans departments that are here to help assist your questions today. And first introduction, and please put your camera on when I introduce you, but Rhonda Hathaway. Rhonda has been with customer service for over 2 years and assists people with their day-to-day operations of customer service. Her role is to assist members with understanding their benefits, how claims are processed, etc. And she enjoys helping members understand their health insurance to ensure that they're able to receive the medical care they need. The next introduction, Brooke Strenke. And Brooke has been with us with Samaritan Health for 13 years. And she has been with the enrollment department for the last 10 years. She's been the supervisor of enrollment for the last 7 years. So we're happy to have Brooke with us. Next for introductions, Alexis Oxenhandler. And Alexis has been the manager of appeals and grievances for 6 years and with Samaritan Health Plans in general for 13 years. So brings a wide breadth of experience. And next, Bridget Quest. Bridget is the director of a number of departments that encompass member engagement. She's been with Samaritan Health Plans for just over 2 years. And prior to joining Samaritan Health Plans, she worked for another Oregon health plan and briefly worked for the state of Oregon Insurance Division. So again, a wide breadth of knowledge that Bridget brings to our health plan. Next up for pharmacy, Marika Davies. And Marika is the pharmacy benefits coordinator, and her role focuses on Medicare Part D, that is the prescription coverage. She has been with Samaritan for 4 years, and we're really lucky to have her. Next, Lucy. Lucy Vincent is provider relations, and she's originally from Miami, Florida, so she moved from one coast all the way to our coast. And she has been the manager of network strategy and contracting for the last couple of years. She's worked for Samaritan Health Plans for the last 8 years. And again, very, very lucky to have Lucy in our midst. With that, we are going to get to some of the questions. And first up, for anybody that could explain how our members will get their cards. There was several questions related to that. And who would like to take that one on?
Sure, I can take that one, Dr. E.
Okay.
So the card will be mailed to you. So for anybody who was eligible on as of January 1st, you should have received that in the mail already. If you haven't, please let us know. We can get another one sent to you. And if you've joined later in the year, then you'll get that within at least 30 days of when you enrolled. So it should come to you before your first day of eligibility, but it depends on when you enroll with the plan. If you're really, close to your start date, then it might be a little ways in.
Danielle, there were several questions in the chat about dental care and what is covered and not covered. Could you quickly go through that again? So could a person go to their dentist for a cleaning and use their card? So that's with the dental hygienist.
Yeah, absolutely. So the majority of any dental service is going to be covered with your card. So really the only thing that we don't cover is orthodontia, which anything else, the cleanings, exams, fluoride treatment, crowns, caps, dentures, whitening services, implants, all of those things are covered under that dental benefit using your benefits card.
And Danielle, Linda was wondering, so a normal tooth extraction, that is not covered under the new benefit card?
A normal tooth extraction would be covered, yes.
Would be covered.
Would be covered.
Thank you. All right.
If it's not for like preparation of radiation therapy, it's covered under the card. If it's for radiation treatment, that falls under the medical dental. That should be billed to the plan.
This was a good question. So if they need glasses, if any of our members need glasses, Does that provider have to accept Samaritan insurance, or could they go to anybody that sells glasses, for example, Costco?
Yeah, so they don't have to accept our insurance now because we are using that benefit card. That's part of the reason why we added it for these benefits is a lot of these providers don't like to take Medicare insurance or bill Medicare insurance. So with this card, we've eliminated that need because it works just like a debit or a credit card. The only providers that you still couldn't see are ones who have actually opted out of Medicare altogether. And they would likely tell you that up front, but you can also ask them.
There's a question from a member that has our Advantage Premier Plus plan. And for dental services copay amount, over the phone it states $0, but online it states Medicare covered $25 copay. So we may need to go back and do some extra looking in on that. But Danielle or others, do you know offhand what that appropriate answer might be?
Yeah, so there is a copay that's associated with the Medicare covered dental benefit that I mentioned, which is that medical dental. It's a very specific subset of services that are covered. But otherwise, there is no copay. You just have that dollar amount that we allow each year.
Thank you. And there was a question that I had responded to in the chat about if a card is lost and a person needs a replacement. I put in the chat that the best place to start with is Member Services Department first at 541-768-4550. Is that the appropriate place?
Yeah, so you can also do it yourself through the portal. If you log in, there's an option to report your card as lost and stolen, and then it will automatically trigger a new card to be mailed to you. But you know, if you're not comfortable using a computer or find it hard to navigate to, then absolutely call customer service and they can get that ordered for you.
Great. There were a few questions about the transportation company, and that's our ride line company. But how does a person access that ride line? Do they go through member services? Is there a number, another number that a person has to phone?
Yeah, so there is a phone number to call Rideline directly. Our customer service department isn't able to help schedule rides, so they would either provide you the Rideline number or transfer you over to them. And we have a slide here at the end that has resources listed and the Rideline number will be on there.
Just want to re-ask about hearing aids. So I see that hearing aid supplies are covered, but supplies don't include the batteries. And I just find that is funny, but that's just the rule that CMS or Medicare comes up with, correct?
I know, yes. Yeah, unfortunately, CMS says very clearly under the hearing aid benefit and even the OTC benefit that we are not allowed to cover batteries.
All right. And I'm just going to scroll down to see if there's some newer questions that I just haven't seen yet in the chat.
Sure, and I want to take an opportunity to just really quickly to address the questions that were sent to us ahead of the meeting.
Yeah, please go ahead. Yeah.
You know, mostly around the OTC benefit. So there's questions about how the list is created and who decides what goes on it. So the list is created based off of what CMS says that we're allowed to cover. So those categories of things that are ineligible or eligible. And then we went in as the Medicare programs team, myself, part of my role is to be responsible for member materials. And we've put in examples of, you know, common items that fall under each of those categories. So it's certainly not all inclusive. Unfortunately, there isn't a good way for me to list every single thing that is coverable or not coverable under that benefit. And there are questions about vitamins as well. So those are items that CMS considers dual purpose, and so they're not able to be covered using that benefits card at point of sale. But if you do pay out of pocket for them, you can submit for reimbursement and we'll refund you that money for those. And there's a question, what becomes of the leftover money that's put into the card? So it basically just stays with Samaritan. So which kind of leads to the second question of where does that money come from? It's from the plan. Essentially, it's a supplemental benefit that we get to offer to you in addition to what Medicare requires that we cover. And so it doesn't go, if you don't use it, it doesn't go to the vendor or somewhere else. It basically just stays with the plan in a pool of money that's set aside for this benefit specifically for members. And there was a question again regarding the list. If we make changes to it, how will we communicate that out to members? If we do make a change to the list and covered items, there's a couple different ways we would consider doing that. Potentially we'd mail a postcard that lets you know we've made an update to the list and you can view it online, or you can request a hard copy, or we might consider just sending an updated hard copy to every member. So we would weigh that out. And then the last one I see here from this list is what prevents someone from spending any of their remaining money each quarter on items for family or friends, or basically how do we protect against fraud? So it would be similar into the way that a debit or credit card is protected from fraud. It's got your name on it. It's to be used for your purpose, not to pay a bill for somebody else. I guess as far as OTC items, if you purchase aspirin, but your whole household uses it, that's that's just the way that goes, that's fine. So hopefully that answers that. And there was one question from another member that I'm going to have to do some follow-up on, and that was in relation to coverage of a sharps container. So that unfortunately is not covered under the OTC benefit, but I'm still doing a little bit more research on many other ways that might be covered. So we'll follow up with that in the email or mail that we send everybody.
Great. What about replacement dentures? Are those covered?
Yeah, they should be. Yeah.
Okay. And for those people that are using RideLine, does that mean they get a ride to and from? So from their home to the place that they need to go to and then back to their home?
Yes.
Okay. Can you use the benefits card in Costco?
So you should be able to. They are a covered vendor. Because I think they don't, you might have to select a PIN for them, because I can't remember if with Costco, if it's that you can use a credit card there and not a debit card, or if it's the other way around, but yes, it should work in Costco.
Okay. And does the benefit card cover dental copay?
So not if you're receiving Medicare covered dental services. That's the only benefit that has a copay associated with it on our plan.
Okay.
So that would have to come out of your pocket.
I recall you stating before, if OTC items were bought, but they didn't have their card at the time, is there a way to use the card after the fact? And I know you can't use the card, but you could submit the reimbursement form that's found online, correct?
Yes.
Okay.
Absolutely. Or even if, we recognize this is a new benefit, and we're still learning things about the card too, and we know members have expressed some frustration because there are certain items that you would expect to be covered because they're listed on the eligible list, but when you get up to the register, it doesn't work. And if you experience that, and you can make that decision right there at the register though, do I want to pay out of pocket for this, and then I can submit for reimbursement, or you can put it back. But any of those items, you can submit for reimbursement and we'll pay you back for that.
Great. And another question was Tylenol, or its substitute is acetaminophen generic. Is that covered with the benefit card? And seeing that's an over-the-counter medication, I would assume yes?
Yes. Yeah, Tylenol is covered.
All right. Are there people that have their hands up that might want to ask a specific question of us? And let me just look to see for those that might have hands up. Bear with me.
Several in here.
All right. So I saw first a area or a 4-digit phone number that ends with 9835. right, that one may have gone away. I see also a hand up next with the last 4 digits of 3100, and I'm just going in order.
Yes, I wanted to ask a question. When I went to Walmart they sent me a list of things that were covered, but when I went to Walmart, they wouldn't accept it. So like Advil was on the list, but it wouldn't pay for it with the Samaritan benefits card.
Was it maybe a store brand generic that you were trying to purchase, or was it the brand name Advil?
The brand name. It was a brand name. I forget the true. It was a triple. Well, no, that was just Advil, regular Advil. So the brand name Advil, and it wouldn't take it.
Well, I'm sorry that didn't work. I would certainly expect that to have been successful at the register.
Yeah, it was right on the list, and that's why it kind of made me scratch my head. That and a couple other things, it wasn't covered, but so I had a question for that.
Okay. I don't know. I mean, if you're comfortable providing your name, it's something I can look into a little bit further for you.
Yeah, my name's Anthony Guerrero.
And also a reminder, if you paid out of pocket for something that could have been covered with the card, we do have that reimbursement form on our website that you'd be able to get reimbursed.
Yeah, absolutely.
I'm not too good with websites.
Okay.
But
okay, we can also mail that to you too. So I'll take that away, Anthony, as a follow-up to kind of look into more, and then we can mail you a form or several copies of the form if you want to have that.
Okay.
Yeah, thank you very much.
Yeah.
And Dean, I see your hand up. Did you have a question to ask?
If you don't have the ability to talk, you might have to unmute yourself. We've unmuted you as Dr. Ewanchyna.
Okay.
There you go.
No, I think it's been covered.
Okay,
I had the
great,
same
thank you.
problem at Walmart.
Okay, thanks so much. And next on the list, I see Bob and Linda Brown. They had their hand up. And we could unmute you too if you need any help. Their names just went away, so maybe their question was answered. I'm going to go next to Dennis and Darina.
We're good.
Okay, thank you.
Thank you.
Next up, I have phone number ending in 2226. And that number just went away, so maybe their question was answered as well. Richard Lofton, did you have a question?
Thank you.
All right, thank you.
Can you hear me?
Yep, we can hear you.
Okay. I have a question I have the Premier plan and it says there's $1,000 dental benefit. Now, does that $1,000 include the $800 on the card, or is the card additional?
So you would just have $1,000 loaded onto your card for your dental benefit for the entire year.
I guess maybe I'm not making myself clear. The card gets loaded with $100 every quarter. Is that correct?
That is just for your over-the-counter benefit. So there's an over-the-counter benefit that is $100 per quarter, and then your dental benefit is $1,000 per year. That's loaded on the card.
Okay. So if you go to the dentist and you get $1,000 worth of work, do you give them the card, or do you just pay and get reimbursed?
Yeah, you would want to give them your card, and they'll just swipe it, and that'll pay for those services for you.
So it would automatically tell you that the charge is more than $100 for the quarter.
That would be for OTC. But yeah, for any of them, if you go over the amount, it will only pay for what the card allows or what your benefit allows for the year, and it would deny any amount that's over that.
Okay, I'm getting a little confused, and I'm sorry to take your time, but
Nope,
there's
that's
there's $1,000 benefit, okay,
for dental.
for dental. So how do you pay $1,000 on a card if there's only $800 available on the card?
And I may not be understanding your question fully. So when you receive your card at the beginning of the year, it'll be loaded with that full $1,000. And then if you used any of it, then it would automatically deduct that amount, but only that amount that you've used. So maybe you had a cleaning or an exam and that only costs $200. Then going forward, you have $800 left to use for the year. But if you go have another service, that costs $1,000, but you only have $800 available, it'll pay $800 on the card, and then you would be responsible for paying that additional $200 out of pocket.
Okay, so if I go to the dentist and the charge is $1,000 and I pay for it with the card pays for it. Now I go over to get a new pair of glasses and I give them the card and the glasses cost $80. Does it pay for the glasses?
Yep. Because you have a separate benefit that's $125 to spend on glasses.
Okay, thank you very much. You've cleared that up for me. I appreciate it.
Yeah, you're very welcome.
Right. So I apologize that there are other hands that we're not going to get to today just because our hour is up for our lunch and learn. Having said that, we've been keeping track of the questions that are in the chat, and we will ensure that we get those responses out to you by email. Also, please watch your mail because a $15 Safeway gift card is going to be mailed out to you within the next 4 weeks. And also give us your feedback about today's lunch and learn. We always appreciate hearing from you. We're going to email an evaluation form to you along with the link for today's recording of the presentation. And please take a moment to complete that brief survey that comes out as well. And as a reminder, for all benefit questions, concerns, we really like to hear from you. We have willing and capable customer service that is ready to take all of your calls for your health plan needs. So without further ado, we will see you for our next Advantage Health Plan Lunch and Learn. And we're so thankful that you are one of our Advantage Health Plan members. Our care is local and we are here for all of you. So have a great afternoon. And thank you for joining us today.
Thank you so much, everybody. Have a great day.
Yeah, thank you.